Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, it's my task to share with you the Health Emergency Operating Center Situation Report for today, Wednesday, June the 10th, 2020. The World Health Organization tells us that to date, there are over 7 million persons impacted by COVID-19. And when you look at the data as at May 14th, that's almost a month ago, you can see that there has been an increase of almost 3 million persons within that short space of time. The total number of deaths today stands at 407,159. And again, you could see there has been an addition of over 100,000 persons between May 14th to present. And so the COVID-19 pandemic continues globally. Now, closer home in the Caribbean sub-region, when we refer to the Caribbean sub-region, we are really speaking to about 33 countries or territories close by. And as at June 8, 2020, there were 33,157 confirmed cases within the Caribbean region. And based on the data, if you look back to what the figure was on May 14th, it was just at a little over 17,000. And so you can say basically the figures or the numbers have doubled in less than 1 month. There is hope in terms of recoveries within the Caribbean region. We've had over 15,000 persons recovering. In terms of deaths, the death toll in the Caribbean region is almost 100,000. It's at 937, and on May 14th it was 728 persons. Now let's come closer home to St. Kitts and Nevis. To date, we have tested approximately 417 persons, and 402 of those results have returned negative. And as we speak, we do not have any samples being processed or any results pending. In our government designated facility, we presently have 13 persons, and to date we have almost 830 persons who would have been released from quarantine, and that's between January of this year to present. So to date, St. Kitts and Nevis have only had 15 confirmed cases who have all recovered. So at present, we have 0 active cases. Actually, it's approximately 52 days since we would have announced our last case, and that would have been round about the 19th of April or thereabout. So, where are we? Today, June 10th. Again, we have 0 active cases. So yes, we would have contained the first wave of the COVID-19 cases. So the Ministry of Health continues active surveillance. So basically, we are focusing on all those patients who would be accessing care at the various health centers, St. Kitts and Nevis, and the hospitals, who will be accessing care for respiratory symptoms and other COVID-like symptoms. And so over the next 1 to 2 weeks, we will be looking closely at those numbers. And then I want to just underscore that our borders remain closed. Based on the fact that we have 0 active cases, we continue gradual relaxation of restrictions. Now, this process continued today. We had a very successful, I would say, stakeholder meeting this morning at the Royal St. Kitts Hotel, whereby the COVID-19 task force would have collaborated with the Ministry of Tourism and the St. Kitts Tourism Authority. We would have met with all the restaurant and bars, all the operators of the restaurants and bars, and all the relevant stakeholders to discuss the reopening of restaurants and bars. Risk. Based on the fact that we have 0 active cases, it means that the risk of exposure to the virus within our closed borders is reducing. However, based on the latest situation report coming out of the Caribbean Public Health Agency, we are being told that the risk of further cases occurring in the Caribbean region remains very high. And you and I are aware that the risk of further cases occurring further afield is also extremely high. And so it follows that if and when our borders reopen, the risk there's a high risk of the virus being reintroduced into the Federation. And so what are we doing at present? The Federation's response to COVID-19 continues, even though we have 0 active cases. And our response continues to be guided by the World Health Organization, the Pan American Health Organization, the Caribbean Public Health Agency, and the Ministry of Health. And the measures include: we continue to coordinate, plan, and monitor our COVID-19 response. Our risk communication continues, and so we continue to engage the public and share with you the latest information regarding COVID-19. And this forum is one such means of engagement. Active surveillance continues, whereby we are continuously monitoring for patients who would be accessing or seeking care for COVID-like symptoms. Our response teams continue to be trained. In terms of our laboratory capacity, it is with pleasure that I share that the Ministry of Health, and in particular the JNF General Hospital Laboratory, just received a molecular machine whereby we can offer the molecular test at our public institution. We continue infection and prevention and control in terms of capacity building for our response teams, and we continue maintaining the delivery of essential health services during the pandemic. And then again, we cannot overemphasize the importance of our continuing to adhere to the physical and social distancing measures. We have been speaking about the potential of having a second wave, and again the Ministry of Health continues to prepare itself for same. So at present we are reviewing our response so far. In other words, we are reviewing what we would have done between January to present. We are noting our successes, we are noting the gaps, and we are plugging the gaps. And in so doing, we are strengthening our health services. We continue training our staff, and so capacity building is a priority as we continue our preparedness and response for COVID-19. Thank you.
Thank you very much, Dr. Laws.